Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
All right, let's talk about something huge when it comes to diabetes: exercise. And look, we're not just going to say it's good for you. We're going to dive deep into why exercise is one of the most powerful, absolutely essential tools you have for managing and even preventing this condition. So let's get right into it. Okay, here's our game plan for today. We'll start with why exercise is basically a powerful medicine. Then, we'll get into a really important distinction, the difference between just being active and doing real exercise. After that, we'll cover the official playbook, what the experts say you should be doing. We'll talk about how to do it all safely and wrap up with how you can build a personal plan that you'll actually stick with. So, Section 1, Exercise as a Powerful Medicine. And I love this subtitle, Why It's a Non-Negotiable Treatment. That's the mindset we need to have. This isn't just about feeling good, it's a core medical intervention. Let's get this straight right from the start. Exercise isn't just some nice-to-have bonus. No. It's a treatment. It should be right up there on your prescription list next to diet and any medications you might be taking. Why? Because it actively changes how your body works from the inside out, for the better. Okay, check this out. This is absolutely mind-blowing. What this quote is saying is that with regular exercise, your body can literally grow new blood vessels to go around completely blocked arteries. Think about that. It's like your body is performing its own natural bypass surgery. It just goes to show you the incredible life-saving power exercise has on our circulatory system, which, as you know, is a huge area of concern with diabetes. So yeah, think of exercise as your personal shield. It's actively protecting you. We're talking about seriously reducing your risk of the big stuff, heart attacks and strokes. And get this, it can halve your risk of ever developing diabetes in the first place. That's huge. It also helps fight off those awful complications like blindness and nerve damage. And of course, the better you manage things with exercise, the less you might need to rely on medication down the road. All right, moving on. This brings us to a really crucial question. Is all movement created equal? You know, you hear about getting 10,000 steps a day, but is getting those steps by puttering around the house the same as going for a brisk 30-minute walk? Let's find out. So here's the deal. That incidental activity, walking to the mailbox, doing chores, it's not bad, but it's not the same thing as real exercise. It just doesn't deliver those critical metabolic benefits we're after. What you need is structured exercise. We're talking about a planned, continuous effort for at least 20 minutes that actually gets your heart rate up. That sustained push is the magic ingredient. It's what flips the switch in your body to start making all those positive changes. So how does this all work on a cellular level? It's pretty cool, actually. Exercise is what scientists call an insulin mimetic, which is just a fancy way of saying it acts like insulin. So picture this. Your muscle cells have these little locked doors, and they need a key to let glucose, sugar, in for fuel. Normally, insulin is that key. But exercise is like a master key. It can open those doors all by itself without needing any insulin at all. This means your muscles can suck that sugar right out of your blood, which of course lowers your blood sugar and makes your whole system way more sensitive to the insulin you do have. Okay, so we're sold on the why. Now it's time for the how. This next section is basically the official playbook. This is your evidence-based prescription for exercise straight from the experts. All right, let's break this down. Think of it like a recipe. First, frequency. You're aiming for 4 to 6 days a week. Consistency is everything. Next, time. Each session should be between 20 and 60 minutes. And intensity. This is super important. You need to get your heart rate up into that 55 to 85% target zone. And finally, type. You want a good mix of aerobic exercise, some strength training, and a bit of flexibility work. That's the whole package. Let's zoom in on that intensity piece for a second, because this is where a lot of people miss the mark. There's a real sweet spot, and it's right around 75% of your target heart rate. If you're just strolling along below 65%, you're really not getting those big metabolic benefits we've been talking about. You've got to get into that zone to make it count. But look, you don't need all sorts of fancy gadgets to figure this out. I absolutely love this phrase, pleasurable breathlessness. What does that mean? It means you're working hard enough that you're breathing heavier for sure, but you could still hold a conversation if you needed to. You're not gasping for air. If you can hit that feeling and hold it for a solid 20 minutes, you're golden. It's such a simple, perfect way to know you're in the right zone. Okay, we've talked about pushing ourselves, but just as important, if not more so, is being smart and safe. When you have diabetes, there are some essential non-negotiable rules to follow to make sure you're protecting your health. Think of this as your pre-workout safety check. Every single time, no exceptions. Step 1, check your blood sugar. You gotta know your starting point. Step 2, have a little snack. Never, ever exercise on an empty stomach. Step 3, take a quick look at your feet. Check for any cuts or sores, especially if you have any neuropathy. And step 4, always have some fast-acting carbs with you. Glucose tabs, a small juice, just in case you start to feel low. It's your emergency kit.
And then there are the red flags, the times when you absolutely should not exercise. These are your hard stops. If your fasting blood sugar is over 250, it's a no-go. Pushing it could actually make your sugar go even higher. Uncontrolled high blood pressure? Don't risk it. Any kind of chest heaviness or unusual shortness of breath? Stop immediately and call your doctor. And finally, use common sense. If it's crazy hot or humid outside, that's just adding unnecessary stress to your system. Take a rest day.
A really effective plan is also a balanced one. You can't just do one thing. Your aerobic exercise, walking, swimming, biking, that's your foundation. But strength training is also key. Building muscle gives you more places to store glucose. And then things like yoga are fantastic for flexibility and stress management. Just remember, the key word here is balance. Yoga is a great addition, but it's not a substitute for that heart-pumping aerobic work. All right, final section. We have all this great information, but how do we actually put it into practice and, stick with it? Because knowing what to do is the easy part. Building a plan that becomes a lifelong habit, that's the real challenge.
So if you're wondering what a good week looks like, here's a great visual. Think about your total exercise time for the week. The lion's share, about 60%, should be that aerobic stuff. Then dedicate about a quarter of your time to strength training. The last little slice, maybe 15%, can be for your flexibility and balance work. It's a simple recipe for a well-rounded routine.
So what are the secrets to actually sticking with it for the long haul? First and foremost, you have to find something you actually like doing. If you hate running, don't try to become a runner. It's that simple. Next, start slow. Don't go from 0 to 100 and burn out or get injured. Listen to your body. It'll tell you when to push and when to back off. A huge tip, schedule your workouts in your calendar just like a doctor's appointment. And finally, none of this is in a vacuum. Make sure you're working with your healthcare provider on all of this. And that's a wrap. We've seen today that exercise isn't just a good thing to do. It's a precise, powerful medicine. It can literally rewire your circulation, act as a master key to unlock your cells, and build a protective shield around your health. The evidence is clear, so the only real question left is for you. What enjoyable exercise are you going to make a non-negotiable part of your life?
Hi there, forest friend. Thanks for clicking on our video. We're so happy you're here. Before we jump in, don't forget to like, subscribe, and share this video with your friends.